Hi, Dr. Ruben Ayala. I'm the Chief Policy and Advocacy Officer for Operation Smile. I've had the privilege of serving in the humanitarian space for more than 3 decades, and it's really a pleasure to be here and be part of PKND. I'm very excited about this panel because if you're looking for the secret sauce, that means you're really trying to get something really good cooking. And what is more important than achieving that unity between the global and the local approach to galvanize and advance resilience and sustainability, certainly when it comes to health. And the ability to have a debate or discussion with some of the panelists included here really should be giving us a chance to shine the light on some really great opportunities. What I see is panelists who represent the civil society from the humanitarian sector, also philanthropy, corporate, academics, and all of us have had an opportunity in one time or another to engage very closely with governments. So it should be a good discussion. I think audience just wants impact. They want to see actions that lead to change. They want to see energy that's put to change the lives of people and to improve human condition. And maybe a little bit of that angle is going to be, if we come up with some ideas that hold true to that promise of things that we could do to improve human condition, how can we make sure that those last? And from the world I come in, at some point we have to ask that question of, if you have really good ideas, how do you turn this into a policy that governs, guides, and influences actions that change the lives of entire communities or countries? So how do we get to shape those policies in a way that they also are translated into real implementation? Again, how do you have good ideas that translate into policy that are implemented to achieve change and improve the lives of people? Anybody who wants to be of substance in the life of someone else should be open to the ideas and the knowledge that others offer, especially if they're seeking to achieve the same objective. So participating in this forum just gives us that platform to come together with people who are sharing a unified vision, but they're looking at that vision through the lens of their own experience and giving us that openness to understand through different lenses what we could actually achieve together. I would just say that it's probably time for all of us to give up on those preconceived notions on what is and what isn't. When we look at taking care of people in different communities or being part of efforts to help communities, including our own, so many times we are held up by these preconceived notions. At some point, I've heard someone say, academics are too bureaucratic, governments are too corrupt, academics are too bureaucratic, corporates are only about profit, NGOs are only about image. And that shaded view of the world almost holds us back from looking at what is good, what people offer, and bringing it together to actually achieve change. So I'm looking forward to just asking ourselves that question: what's holding us back from achieving the ultimate objective of giving people a good life through health?